So we're going to talk about secrets to longevity. And you know, when you go on a quest for the Holy Grail, you want to find the Holy Grail, you know, you don't expect somebody to just give it to you, right? You have to go through some challenges. So we're going to have some challenges. And then we'll talk about what the subject is. So we're going to talk about vitamin D, the sunshine vitamin first. And I was sitting next to Anna back at the table, and she asked me, what was the big dilemma about vitamin D? And I said, there's no dilemma, but I'll tell you about it at the talk. I'm not going to tell you now. Vitamin D, the sunshine vitamin. Vitamin D, is it a hormone? Is it a vitamin? Is it both? Is it all of the above? None of the above? How are people at taking multiple choice tests in school? Good, bad. Sometimes they're kind of like this, hard to figure out. Vitamin D is called a vitamin, but it probably was misnamed. Vitamin D is something that our bodies can make, and we make vitamin D from the sun. Really, the official definition of a vitamin is something that you must get from the outside that your body can't make. Really, we make vitamin D. But even in sunny Southern California, almost everybody is low in vitamin D levels. And why should we care? I'll tell you why we should care. Vitamin D is involved in about 400 different processes in our bodies. Vitamin D is important for maintaining bones and preventing osteoporosis. Vitamin D, adequate levels of vitamin D prevent cardiovascular disease. Adequate vitamin D levels prevent cancer, breast cancer, colon cancer, and prostate cancer. So vitamin D is now recognized as extremely important. And vitamin D looks chemically like a hormone. It looks like one of our steroid hormones, and our steroid hormones are things like estrogen, progesterone, testosterone, DHEA, very important things for the functioning of our bodies. So the correct answer is C, both A and B. Now, most people don't get enough vitamin D production in their bodies from the sun. And some of that's the result of a tremendous amount of public education about using sunscreens and not being out in direct sunlight to prevent, to try to reduce risk of melanoma because of ozone, protective ozone layers gone in a lot of areas. And when we're out in the sun, we get some carcinogenic rays from the sun. Well, now it's being recommended to be out in the sun, direct sun, for about 10 to 15 minutes without sunscreen, with your arms, chest, and face exposed to the sun at least 3 times a week. The other thing we do is supplement people with vitamin D. We take vitamin D tablets or capsules. And the one that you want is called vitamin D3, not D2. And I don't recommend taking high doses of vitamin D on your own. Vitamin D is a vitamin that needs to be monitored, and you monitor it with laboratory testing, blood tests, to be sure that it's not getting too high, because you can get vitamin D toxicity, which will make you feel bad, and it's not good for your body. So I want to tell you about vitamin D, not so that you should go out and take large amounts, but so that you can be sure that your doctor is checking your vitamin D level and having you supplement vitamin D if you're not getting enough from the sun. Okay, well, we already answered this one. Vitamin D is a cancer prevention. And these are the things that I talked about in terms of benefits of vitamin D. Decreasing breast, prostate, and colon cancer by as much as 75%. Cardiovascular risk, and vitamin D given to elderly people who are residents in nursing homes, even low amounts of vitamin D prevented falls, reduced the rate of falls by 50%, which is a huge number because falls are very, very seriously in people who are nursing home residents and frail.